I had a troll come on we were talking about COVID and how it wasn't as deadly as people thought it was. He was sure that I was wrong about everything. And I was only trying to sell my book, by the way, but go buy my book. It was never about your health, the COVID pandemic. It's on Amazon, ebook, paperback, and on hardcover. We're about to go over something that this gentleman didn't think existed. He claimed that this doesn't exist, and before I was able to pull up the study, he ran away like a hoe. We are about to go over Dr. John Ioannidis' seroprevalence data study from the World Health Organization website. John Ioannidis is widely recognized as one of the most cited and respected scientists in the world for public health. He has a citation index of 196, and that's enormous. He's been cited 267,437 times by April of 2020, ranking him 87th globally among highly cited researchers. Publications like The Atlantic in 2010 described him as one of the most influential scientists alive. He was widely renowned as the public health expert until Fauci decided he was going to call himself that, and they deleted this man. They did not care that this man has a peer-reviewed study. This is the World Health Organization website right here. I am on the World Health Organization website. We're talking about the study found on it. YouTube. If you mark this video as medical misinformation, you will actually be the one that is spreading medical misinformation, because what I'm about to say is fucking true. It is peer-reviewed on the World Health Organization website and has been there for fucking years. I'm not making this shit the fuck up. Now, instead of reading this whole thing, I did do an article on it. I know, huge shocker, that I did an article on it, because that's what I do nowadays. But let's just get it on with it. 2020, the world grappled with fear, uncertainty, and sweeping mandates in response to the COVID-19 pandemic. One scientist dared to challenge the narrative with cold, hard data. Dr. John P.A. Ioannidis, a renowned Stanford epidemiologist, published a groundbreaking seroprevalence study that peeled back the layers of hysteria to reveal a truth that should have reshaped our approach to this crisis. His work, featured on the World Health Organization website, calculated the infection fatality rate, IFR, of COVID-19 using global seroprevalence data up to September 9th of 2020. The findings were nothing short of revolutionary. The virus was far less deadly than feared, particularly for those people under 70, and natural immunity offered a robust defense. Ioannidis' study should have made him a national hero, ended all mandates, lockdowns, mask wearing, and vaccine development, and shifted our focus to protecting the vulnerable while letting society thrive. The study that should have changed the game, Ioannidis' paper titled Infection Fatality Rate of COVID-19 Inferred from Seroprevalence Data, analyzed 61 studies across 51 locations worldwide to estimate how deadly COVID-19 truly was. And by the way, one more time, he is seen as the leading expert in meta-analysis, epidemiology, and public health. Unlike crude case fatality rates, which only consider confirmed cases, the IFR accounts for all infections, including asymptomatic and mild cases detected through antibody testing. His findings were staggering. The medium-corrected IFR across all locations for all ages in the world was just 0.23, in line with a bad season of the seasonal flu. That's literally it. Far lower than the apocalyptic figure driven to global panic, which was like 3.5 or something like that. For people under 70, the median IFR is 0.05. It is less deadly than the seasonal flu. 0.05. That means that 99.95% of all infected individuals in this age group survive. That is under 70. And that is not even including the fact that a case for a fat person that's under 70 and a case for me that's under 70 are vastly different things. His numbers still include everybody that died of a car accident that was listed as COVID, or died of a gunshot that was listed as COVID, or died of stage 4 cancer and then they tested him for COVID and it came up positive, so they marked it as a COVID death, because every death was being marked as COVID if they even thought the person might have had COVID. And that's a fact. This paints a clear picture. For those under 70, the risk of death was negligible, often less than 0.1. Even in high mortality areas like Connecticut or Louisiana, the IFR for younger individuals remained low. For those over 70, the risk was significantly higher, but still manageable with targeted interventions like enhanced healthcare access and voluntary isolation support. These numbers should have ended the one-size-fits-all approach to mandates. Seroprevalence data showed that millions had already been exposed to the virus in the fall of 2019, many without symptoms and developed antibodies. This natural immunity, robust and long-lasting, was evident in locations with high seroprevalence, yet low mortality and amongst younger individuals. Studies since 2020, such as those published in Nature 2021, have confirmed that natural immunity provides strong protection against reinfection, often rivaling and surpassing gene therapy-induced immunity. The mandates ignored this reality. Instead of leveraging natural immunity to protect society, governments pushed for universal vaccinations, masks, and lockdowns, disregarding the low risk to most and the protective effects of prior exposure. Ioannidis' data suggests that allowing the virus to circulate amongst low-risk groups, anybody under 70, while shielding the vulnerable, could have built herd immunity faster, sparing economies, mental health, and personal freedoms. The argument against mandates, lockdowns, mask mandates, and gene therapy development were sold as necessary to save lives, but Ioannidis' data exposes the disproportionate impact. Lockdowns crippled economies, with the International Monetary Fund estimating a global GDP loss of $3.5 trillion in 2020 alone. COVID is not a danger to me, has never been a danger to me. And as far as I'm concerned, how I'm going to live my life in a healthy way will never be of concern to me at all.